The brachial plexus is a network of nerves that originates at the spinal cord near the neck and passes down your upper arm from under your collarbone. This network can be injured during the birthing process and is referred to as obstetrical brachial plexus injury. The brachial plexus consists of 5 nerve roots. These include nerve roots from the lower cervical segment of the spinal cord known as C5, C6, C7, and C8, and a nerve root from the first thoracic spinal cord segment known as T1. These nerves join to form the upper, middle, and lower trunks of the brachial plexus, which split into nerves that supply your upper limbs, controlling your shoulder, elbow, wrist, and hand. An injury to any part of these nerves can stop signals to and from the brain and may partially or completely paralyze your arms. Types of brachial plexus injuries that may occur in infants include neuropraxia. The nerves are stretched, but their internal architecture is maintained. With time, they are likely to recover more or less completely. Axonotomesis. The nerves are stretched and their internal structure is partially damaged, with the outer sheath still intact. Such nerves are likely to recover over time to a greater or lesser extent, depending on the magnitude of damage. Neurotomesis, or rupture. Nerves stretch to a point where they tear at a region some distance from their origination from the spinal cord. Avulsion. The nerve roots are torn completely out from the spinal cord. There are 3 main categories of OBPI. A, involving C5 and C6. B, involving C5, C6, and C7. C, involving all the roots, global. The first 2 categories are usually referred to as Erb's palsy, which disrupts functions of the shoulder and elbow muscles. Erb's palsy is the most common pattern of brachial plexus injury in infants. The third category involves injury to both the upper and lower nerves. It is a severe condition called global or total brachial birth palsy. Another type, called Klumpke's palsy, involving only C8 and T1, is extremely rare and affects the functions of the forearm and hand. Causes. Injury to the brachial plexus can occur during the birthing process when the baby's shoulder gets lodged in the birth canal, requiring external force for the baby to be delivered. This force may stretch or tear the nerves of the brachial plexus. This type of injury is commonly seen in larger than average babies born to diabetic mothers. Other causes for brachial plexus injury in babies include extended period of labor, breech presentation, baby positioned with feet or buttocks near the vaginal opening, mothers with a small birth canal. Signs and symptoms. You may be able to observe the symptoms of injury in your child immediately after birth. Common symptoms include limp arm and loss of flexion in elbows. The baby does not actively move or rotate the arm from the shoulder. The baby is unable to actively move fingers or has a decreased grip strength on the affected side. Subsequent course. As mentioned above, the injury to nerves is incomplete in a majority of cases. Thus, in about 3/4 of cases, there is complete or near complete recovery of function over a period of months. During the process of recovery or nerve regeneration, some nerves may get misdirected or cross-innervate. This causes opposing groups of muscles to contract and is called co-contractions. Uncoordinated muscle recovery may cause muscle imbalance. Co-contractions and muscle imbalance together can lead to contracture,